All right, welcome back to another episode here with a very special guest from our same state in Austin, Texas. We're up in Dallas, Dr. Kendall Stewart. Welcome to the show.
Thank you so much. I appreciate it.
So,
Thanks for having me.
Dr. Stewart, you've been in practice, is it 1994? Am I
Yep,
right?
been in practice since '94. Yes, I'm trained in ear, nose, and throat, and I also did a fellowship in skull-based surgery and neurology. So when I first came to Austin, I was unfortunately opening a lot of people's heads and taking out tumors because nobody did it before. But I really found out through my time in that early practice that I really enjoyed preparing people for surgery
Hmm.
and getting them to recover quicker because the surgery is pretty straightforward, but really how they approach the surgery and how healthy you are when you go in and you come out makes a big difference in how the outcome of the entire process.
Yeah, so you can prepare people for surgery. I feel like
No
it's
doubt.
a
No,
tough task, but again, I think it's
absolutely.
noble.
Yeah.
Um,
Yeah. In fact, I'll tell you a funny story. Um, and I've mentioned it on my podcast before, but in 2002, we had some Blue Cross Blue Shield people call me because they noticed that I got people out of the hospital a little over a day earlier than most people in Texas, and they wanted to come talk to me on how. And they came down with like five executives, and we sat in a room and only lasted about 10 minutes because when they found out it was nutrition and preparation in that way, they didn't want anything to do with it. And so the meeting was over, and it
it's
was
sad.
very sad.
So
But anyway,
again, you've been doing again, kind of diving into that. You've been doing functional medicine before it was
yeah,
functional medicine, right? Before it was
absolutely.
more trendy and out there.
Oh yeah, because well, I have a biochemistry background. I did research in biochemistry at MD Anderson and cell biology and did a lot of research in viruses and
Mhm.
in the standard medical world, viruses, there's not a lot of easy ways to deal with them with medicine. So making the body's immune system more effective at handling them is typically the best way to approach most of those viral elements. So it was something I got interested in very early on. So,
And I love to like you still practice, you're on the research side, you're in the trenches. So for me as a guest, we have guests that are more just, research or advocacy, which is great. This is kind of nice too, because you're getting your hands dirty and you're taking things that are research based or textbook based and you're applying them for since 1994.
yeah, I mean, that's really the key. And I like to say I didn't do any of this research because that was
Hmm.
great scientists, but I'm really good at assimilating data and coming up with a nice clinical application for it.
Hmm.
And I think that is, we're a good provider, a professional, a physician, a doctor who takes care of you. That's what they're supposed to do. So,
100%. Well, this is great. In terms of from a functional med standpoint, obviously we both practice in this space. We've had mutual patients. Um, again, to me, it's when you hear other providers that are like, oh, functional medicine is BS, let's say. But, to me, it's like you just said it, it's an understanding of biochemistry and physiology down to like the exact piece and details of it. I'm like, okay. And so my response is like, they forgot it. Like they took their boards, they forgot the biochemistry and they went straight to like pharmacology.
right. And that's really true. But, I like to, and I've taught many thousands of doctors. I mean, especially pre-COVID, I was putting on courses almost every month. And we just wanted people to embrace this understanding because people really don't come to you for a diagnosis. But in
Mhm.
Western medicine, especially in the MD world, the diagnosis is everything to the insurance company. They don't
Yep.
care how you really treat it. And so what's really important is people come to get well. They don't care what you call it. They care how in the world are you going to help me get
Hmm.
out of this. And if you don't address the body as a whole entity, you can't just isolate an organ system because something that's maybe good, even research wise for that organ system, may be completely awful for some other organ system. So you've got to look at everything as a whole. And all cells, whether even though they produce different things, they all work by the same mechanisms that. So you got to have a great battery, you got to have great nutrition delivered to them, You got to be able to keep them not very cluttered. You got to have
Hmm.
them, working in an efficient manner. If you buy a Mercedes, you want to drive the quality of a car that's a Mercedes, and
Yeah.
that's what everybody's looking for. So,
No, that's a good analogy. We often try to, we're taking complicated information and
sure.
trying to get it to a point where it's a light bulb or an understanding. Because I think that's one of the most powerful tools is connecting dots for patients. Like, oh, that explains this cluster of symptoms. Where I think the traditional medical model is like, oh, that has nothing to do with one another. It's like, no, this is an inflammatory response that's systemic. It has everything to do with each other. It's
Yeah.
just that's in that organ system and that one's over there messing up your brain. Still,
Well, Matt, just ask any woman who's premenopausal and ask her how her brain's working from the inflammation of her uterus, and you'll find out really quick.
well,
It's just common sense. And, when you talk functional medicine, if you stay away from the complexity and talk experience for people, they tend to get it because they've lived enough life to know. You know what I
mhm.
mean? So we're just trying to give some scientific validity to it. So, I think practically my whole career has been about proving that what we were saying is right to the guys who are naysayers, and it gets a little frustrating for it, but luckily it's turning around, and I think functional is making a very big move into what I would call more mainstream medicine.
Yeah,
You
I
know,
think with Maha, like that whole aspect, like they're
absolutely.
just
Amen. Yes, sir.
yeah, to me, I think there's a lot of hopeful. Just realize that, like it's your body knows how to heal if we take and address the things that are handcuffing it, and it's not an Advil shortage, it's not a Lexapro shortage. It's like why is the body breaking down? And I like that is now shifting to maybe the thought process that's going to drive the future paradigm.
Yeah, so my expertise because of the head and neck is really the nervous system. And you become very aware very quickly in almost everything we deal with in either peripheral nerves, cranial nerves, brain level, that inflammation plays a huge role in that. And
Hmm.
you really can't separate the immune system from the nervous system. So in 2001, I coined a term called neuroimmune syndromes,
Hmm.
and it kind of got picked up. I don't know if it was me that came up with it first or if I heard it. I can't really remember, but what I can tell you is that you just can't separate those two systems because what I like to say as far as chemicals in the brain, everybody wanted to think that everything in the brain was chemicals, but chemicals don't change fast. If
Hmm.
you have if you have a massive stressor in your life, you may become depressed in a week, but you're not going to become depressed overnight because the
Hmm.
chemicals have to have time to wear out.
Yeah.
But inflammation can change you in 10 minutes.
Yeah.
If you have inflammation in your brain, you can have an anxiety attack overnight. And
Hmm.
that took us a long time to prove. In fact, it wasn't really till 2015 when we were able to label the immune cells of the brain called microglia.
Yeah.
And we're able to do PET scans. And the first study that was done that I'm aware of was the Alzheimer's study. They wanted to know if inflammation was involved in Alzheimer's. Well, guess what? Every one of them. And
Yeah.
so I looked back last year because I was given a lecture, and it turns out that same PET scan study has been done now 320 times on everything from sleep disorder to ADD to ADHD to just about everything you can think of. And inflammation just cannot be separated from the function of the brain. And
Which
yeah, go ahead.
Yeah, which again, that's like we were kind of talking before we started the podcast up, and traditional healthcare, the medical models, like you have the neurologists, you have the cardiologists, but like what system can cross all boundaries of those organ systems to basically sabotage and disrupt, and that's that inflammatory system.
That's correct.
Well,
And so that's why it's also important because most of the things that impact those systems from a lifestyle perspective are related to inflammation
mhm.
or something that's not right. And, as you know, and I think more people are becoming aware of the intestinal tract and the
Yeah.
gut and its role in the immune system too. So, we shouldn't be surprised that we went there. It's just something that wasn't talked about because we like, and I'm talking we meaning MDs, we love to compartmentalize stuff, and that's just not the way the body works. So,
No, it's one of those things where it's easy to compartmentalize to have like again to comply with the system because they need a diagnosis and like, hey, you have these 7 symptoms, we can call it this. But again, I just think that doesn't serve the actual health of the patient, right? It's just having more specific understanding of like the connections. I think that that's where we're going. So, in terms of diet, nutrition, and all this, I know you're heavily involved in like nutrigenomics and testing and explain to the listeners like what is the field of nutrigenomics?
So basically, there's three forms of genetics that are out there. I'm actually an expert in two, and it's because I built companies that are genetic companies. But so there's exome sequencing. That's what you get when you go to the medical school. Okay.
Hmm.
And that is genetics that are related to disease. So
Hmm.
you have this disease, sorry, can't do anything about it. You've got a chance of this disease and don't have any more kids, and I'm exaggerating, but that can be the principle of it. So I call it doom and gloom genetics, and I don't really like it.
Hmm.
Okay. There's nothing wrong with checking it if you have kids that are in trouble and all that type of stuff. It does have its place, but there's not a lot to do about it if you have it. So then there's pharmacogenetics, where we look at the liver enzymes and we find out basically from the liver enzymes which ones work properly, which ones overwork, which ones underwork, and can we have a risk, especially in pharmaceuticals, of poisoning you or having a medicine not work. And believe it or not, it processes hormones and all kinds of other things too. So we have to pay attention to that and even nutritional elements. And I think it's a really important point. The problem is, oh, some people took advantage of it and charged insurance companies a lot of money for it. And so it kind of fell out of favor a little bit. Then the last one, which came around about 2014, probably
Hmm.
maybe a decade ago, is nutrigenomics. And what it really was is we were looking for some type of scientific validation of how a nutrient is absorbed, transported, converted, and how does it work in the cell. Okay,
Hmm.
because you and I both know that we can look at blood and that's just the transport system. It's not what's
Hmm.
going on in the cell. And there's many things that can't get out of the blood into the cell. And so we wanted to have an idea. That's been kind of the holy grail of what's going on down at the cellular level and how do we get to it and how do we know what's happening and what do you need and what do you don't need. And so nutrigenomics became the method of us being able to look at all the pathways with some scientific validity to tell us where the problem was and how how much quantity were we providing of the right nutritional element. So, for instance, folic acid, which a lot of people have heard about, it has to be transported in the cell, and because it's water soluble, it can't enter the brain very well because the brain's covered in fat and water and oil don't mix very
Hmm.
well. So we literally have to convert it through 5 major steps to get it into a form that we can send to the brain. And certain cultures, in particular Anglos and Latinos, which are most of the patients we see here in Texas, have trouble with that. And so
Hmm.
if you can't make that form of folic acid, you can't make your dopamine and your serotonin, and your batteries don't work right, and your detoxification system doesn't work. So nutrigenomics is a scientific method to know what's wrong with you as the individual, not
Yeah,
as a group, you know?
well, that's kind of where I try to again, genetics sometimes overwhelms people, but I try to you're a bunch of different steps in a factory, and you have all these different departments and those are organs, but they all have these little factory steps with an assembly line, and really
Yeah,
what we're looking at is the different steps in the assembly line. Are they slow? Are they fast? Are they inefficient? And hey, what do they need to be efficient? And trying to remove the
sure.
interference, support them and layer in the best support as we possibly can. And again, for years you'd see like kind of like you mentioned, like there's a huge little uptick in the pharmacogenetics. Like, oh, hey, my psychiatrist said if I ran this test, like they know what to give me. I'm like, they know how not to poison you. That's really what like
That,
it,
that's yeah, that's pharmacokinetics, which is the breakdown of drugs. Pharmacodynamics is which drug works for you, and that's the hard one. So that
yeah.
one has not been anywhere close to being uh, perfected, is what I would say.
Well, and that's it. It's like to me, and that's where I feel like most people, if you start looking at the nutrigenomics, makes way more sense because it's like, hey, how do you build serotonin? How do you build dopamine? How do you break those down? How do you break down epinephrine? Like
Yep.
having an understanding of those things, and then it's how do we shape an environment, a lifestyle, genetics, diet, all these things. Like if you got comp enzymes and issues with those
Yep.
genes, should you be crushing caffeine all day and living a stressful life if you're sitting there with anxiety.
Right. Well, the anxiety, the problem with the comp, you mentioned it. It's really not about um, the anxiety. It's about not being able to get over the
Yeah.
anxiety because there's just not enough turnover of the neurotransmitters. So those things are invaluable in treating people. And I love to tell my patients when they come to see me, you have to be selfish. We're only
Hmm.
here for you.
Hmm.
We're not here. Who cares how effective anything was for somebody else? What matters is does it work for you? And I think a lot of people, I mean, Western medicine loves to put all people of all different races in a single box with massively different genetics and then look at percentages of success. And that's just not the proper way to do it. What the patient wants to know is, will this work for me? Whether it's a drug or a treatment or a diet or, you have to be selfish. And that's what a physician has to understand, or, as a provider, you've got to understand, they're there for you. Your relationship with the patient individually is what's important in any, you know, doctor-patient relationship. So,
100%. So for listeners, as we're talking about genetics, when we talk about genetics, it's very common. Like you might run across a term called SNP or a single nucleotide polymorphism. Can you
yep,
explain to them kind of what that is, just so they have an
sure.
idea? It's not this big scary thing. It's just.
So the way DNA works is we have three bases, and you'll see them as A, T, C, and G, okay? And those three bases, we read those three bases as a code, and it tells us what amino acid, once we convert it to RNA, what amino acid we need to put in that chain of making a protein that does whatever we want it to do. So a single nucleotide polymorphism is one of those bases. We look at what most of the population has, and we consider that the normal. So it has to
Mhm.
be more than 50%. And then we look at the response for somebody who's mutated, and we find out one of those bases is different. And if that's common enough, meaning more than 1% of the population, after we check enough people, we're able to put it in the worldwide database. And that just means it may code for a different amino acid in that place. Now, what that has to do with is if we change the structure of that protein, sometimes it doesn't work as well. Sometimes it actually works better.
Mhm.
Sometimes it really can't work at all. And so basically, we're looking at a way that we can look at how the enzymes are functioning and do we have an idea of how we can help that situation? Because if one thing converts to something else and this enzyme can't work, I've got to go put something else in,
Mhm.
second product in to bypass the problem because obviously the way God designs things, and there's not a lot of mistakes. I can tell you there's none that I know of.
Mhm.
Okay. So ideally, it's a way for us to understand what form of the nutritional element we need to put in, which one is appropriate for you, and just as importantly, which ones you don't have to take
Mhm.
because you'll be wasting your money.
Or they might, you could also be a bit more precise. Like these things might actually make you feel really, really crappy because
Yeah,
it
well, that's
might,
true too. Yep. Yep. Absolutely. You're
like,
correct.
so while we're talking like SNPs, genes, like, are there any that you see to be the most common that are the most impactful?
Yeah. So what I like to talk about when people come to see me, I tell them I don't care what your diagnosis is, but I care about how you heal. So I take them through what I call the principles of healing.
Hmm.
And the first principle of all healing is inflammation control. And so in nutrigenomics, we have what I call on switches and off switches of inflammation. And what's really important is turning inflammation off.
Hmm.
So these are the people that get sick and stay sick for a week instead of getting over it in a day or two. And so we're able to look at those off switches very precisely. And the way you nutritionally approach those is different depending on which one you have. The second process that we look at is autophagy, or the ability of the body to essentially clear debris. And it really relates to insulin resistance and the ability to transport glucose into cells,
Hmm.
because my focus is what we call high energy cells, which is the brain,
Hmm.
the immune system, the endocrine organs, and things like that. So we got to have a lot of glucose going into those cells. And believe it or not, if you don't have a lot of glucose going in physiologically, all you care to eat is glucose or carbohydrates.
Yeah.
And that's why a lot of these people do it. And so we look at that, and then we look at neurotransmitters and how your brain is modifying, changing them, clearing them, processing them, and whether there's an imbalance in that, which we can modify with nutritional elements. And then we also love to look at methylation, or the ability to deliver specific vitamins that are used in a lot of different categories. And thirdly, for me, we look at neurotrophic factors, which are basically factors that tell the nervous system to heal itself. So if you don't have good neurotrophic factors, those are people who get like a mild head injury and can't recover, or get a neuropathy, or, you know, hurt themselves and they just cannot heal the system. So we have nice peptides now that can help us with that quite a bit. So in general, our goal is to create the best environment in you to allow you to recover from your problem and feel as good as you possibly can. And we also look at some GI intestinal tract markers so that we know whether probiotics work for you, because there's a lot of people that don't grow the sugars that, and you can't grow probiotics, so you're just taking a bunch of wasted product.
Hmm.
So we then, instead of putting in probiotics, we put in the stuff that the probiotics are supposed to make for us to help
Hmm.
us feel better. So, I wouldn't say that one is more important than the other. It depends on where you are in the process, um, following the what I call the principles. And if you follow the principles and we deal with the ones that are problematic for you, we will have a good outcome in almost everybody.
That's awesome. Um, in terms of, having somebody come in, like what are the most common, like, patient demographics? Like again, you do a lot in the neuroimmune, neuroautoimmune, I'm sure kind of clumps under that category. What do you see on a day-to-day basis as the bigger issues kind of
Well,
plaguing?
so for me, I mean, I've seen over 2,500 autistic patients in my career. So autism has been a very big part of what I do. And it's mostly because the vestibular system, and the sensory systems were in part of my specialty. So they just
Hmm.
naturally migrated. And so, and then I see people all the way up to Alzheimer's and neurodegenerative disease, and we steal from everywhere. So if
Hmm.
you look at the literature, it's very specific, and especially in Western medicine for children versus adults, the body's the same. We
Yeah,
steal from anywhere to get a leg up to try to help people. I mean, and to be in this field and be good, you have to love people. I mean, you just do. And so I see a lot of autism and developmental delays. I see a lot of POTS. There's been a massive increase in postural orthostatic tachycardic syndrome in teenage girls. We see a lot of ADD, ADHD, and all those types of things, which is more an immune process than it is truly a brain process.
yeah.
Okay. Yeah.
The POTS one, we see a lot of like dysautonomias, POTS. Yeah, again, and for us, it's like saying you have a headache, right? Like we don't know what's causing the headache. It's you can be much more specific on kind of the type of headache. And POTS is one of those things where I just before we jumped on a call with having migraines, and again like
Yeah.
low blood pressure, low heart rate, respiratory distress. I'm like, start kind of looking in and just okay, what might be stressing your autonomic system to present the headache as a symptom, but it's really a sign of a global dysfunction of how you move fuel around.
Absolutely. It's fuel, but it's also inflammation. So
Yeah.
the biggest problem we have in most of those people who are teenagers, early 20s, is they have high inflammation because they're trying to grow their body, and they're typically burning the candle at both ends. So, POTS is not a couch potato disease. It affects the athletes and the active people, and you know what I mean? So they're burning a lot of inflammation. They're just having trouble shutting it off. And then unfortunately, there's a viral component to some of that. And with COVID, that stuff has just absolutely exploded because, as you know, the spike protein doesn't like to clear the body very effectively. In fact, it's
Yeah.
very difficult. So,
And the research just keeps on, is it the brain study that came out? It was like 3 years post, and they're still seeing expression of the spike protein, and it's kind of terrifying. Well, and that's kind of this patient, his first symptoms with, COVID is what kind of started his migraine. You go from a few a year to all of a sudden 48 migraines a year, and COVID is what set it off to go to 48, and his symptoms were loss of smell and taste. I'm like,
yep.
yeah, yeah, perfect. Like your brainstem, your olfactory bulb, like nerve, like it makes sense that the brain's still struggling, especially from an inflammatory standpoint.
But the problem was the spike protein was artificial. So I have a background in virology too. So the spike protein was applied to that virus, so which means it can come off very easily. So when it would stick in the ACE receptor, we actually know the ACE receptor, believe it or not, would change uh, its conformation, and spike protein would stick there and break off the virus, and the virus would go away, but the spike was left there. And so the retained amount of spike, even in people who weren't vaccinated and doesn't have their own cells making spike, they basically retained this huge amount of antigenic. Well, it was probably the worst antigen I've ever seen. The only thing that was ever close for me was maybe a little swine flu was pretty bad for us back in
Mhm.
2008. But really, I've never seen anything as antigenically stimulating as what the COVID was.
Yeah, you can go. I mean, I could spend a week talking about
Yeah.
this because I don't think I slept during those first couple of years. You can ask my wife. I'd be going to bed at two in the morning because it'd just be going through the data, and but I remember they've published the pathology of the spike protein, and then they start talking about, like, this is what we're going to give you to make you form an immune response to it. It's like, but if this is like causing all the inflammatory pathology that puts people at risk, like it's just, why not another antigen type mechanism over that one?
Well, from a practical standpoint, from an immunology standpoint, natural infection of a virus, you get the surface proteins, you get the capsid, you get the DNA, and you get the minor proteins. So you get all these different antibodies, and it's not just one because that's how God designed it. But
Yep.
when you're focusing with the technology they were using, you're just looking at that one spike. And I don't know why they didn't choose something else. Why not choose a capsid protein? I'm not really aware of why they did it that way, but the answer is obviously it was a mistake.
Yeah.
So yeah.
No, that's kind of my big thing. Like, why not a capsid or a different, less antagonizing aspect to it?
And the problem is when you get one of the native cells to create that antigen instead of just introducing the antigen as a regular vaccine would, the immune system's going to go back and kill that cell that's making the antigen.
Mhm.
So really you set off a true autoimmune process attacking your own body. And so not a good thing.
Well, and this is where I try, kind of start looking at the fatigue complexes. Obviously, like, there's inflammatory, but even like your immune system needs what to run its show? It needs ATP, it needs fuel. And you
Yep.
start looking at why people have chronic fatigue and exhaustion post-COVID. It's like, if you're always trying to fight an immune complex that's not effectively going away, but you need gasoline to constantly feed your immune system, and
Correct.
you're never stopping driving towards your target.
Right. And the other thing too is the T cell, we know that nothing stressed the T cells, which are your thymic cells that kill
Mhm.
things. They literally fatigue them so much. Even Hopkins put out a paper and called it the new AIDS because it fatigued the T cells so much it was almost like HIV. And God has that fail-safe built in that if my T cells can't kill anything, I'm going to inflame things and create, a lot of antibodies. And so we've seen an absolute explosion of autoimmunity after COVID came through. So I don't know if there's a great answer for it. I mean, I like to use lots of enzymes like lumbrokinase and serrapeptidase and other
Hmm.
things like that to try to help clear the spike protein. If it's bad enough, we even plasmapherese people. So we do therapeutic plasma exchange in
Hmm.
people that are bad enough just to try to stop the inflammatory process. But, that's an expensive proposition to get over
Yeah.
something. But in general, I mean, you've got to get a hold of the immune system, and get rid of the inflammation, or you'll never help the patient, in my mind.
100%. Do you guys do that in office?
We do it in office now. Yes, sir.
Yeah, that's good to know. Again, to me, it's like here I know people, but we have patients down Austin that way, and just having a resource because again, it's trying to get out in front and start chipping away and getting a bit of a leg up on the inflammatory battle is really the ultimate goal.
Right.
Um,
And we tend to use, other things that may be controversial, but the whole idea is that, God designed the immune system to have some good off switches, and if we can enhance that nutritionally and health wise, um, it's going to be successful, but you got to get rid of the antigen first. So.
yeah. Have you noticed anything genetically that might predispose somebody to have a more drastic response? Any kind of genetic markers that you're like, oh, hey, if they have these SNPs or these markers, like they might be more prone to the mast cell or the histamine aspects or kind of other downstream immune aspects?
A huge discussion and it gets very complicated, but yeah, we have seen a bunch of disease processes that really get into the cell danger response where,
Hmm.
and if you're not familiar with that response, the problem with the nervous system is that once it gets into trouble, it doesn't know how to rest. Meaning, I just had a
Hmm.
knee replacement and I had to rest whether I liked it or not. But my nervous system won't do that. So when it's in trouble, it starts working extra hard and it literally will wear out its resources and it will come to what I call a fork in the road where it's either going to decide to work itself to death or it's going to go into a hibernation mode.
Hmm.
That hibernation mode actually separates the mitochondrial energy from the cell. So the cell really and that may be what's going on in autism for a lot of these
Hmm.
kids. But what has happened in that is we're seeing things like Lou Gehrig's ALS and all those rapidly progressive severe diseases starting to show up. And we're seeing even some things in kind of in the middle-aged people where we didn't see them before showing up because there's so much challenge to the system itself. Now, I don't have a great answer for that yet. I'm hoping to have some, but still the way we approach it is the same way. We've got to make sure the body has plenty of supplies of all the resources that it needs. And, the body doesn't need a pharmaceutical drug. It needs nutrition.
Hmm.
It needs something that's useful to the body. So,
Well, again, it needs this mitochondria to have a chance to do what it needs to do to take care of
uh,
business, and
absolutely.
there's no medication that I'm aware of that solves the mitochondrial footprint, and really that's the gatekeeper to how we live and how we age and how we respond to stress and.
We have a couple of genes that can indicate whether NAD plus injections or things like that could work for you. For those who don't know what NAD is, what's used by the mitochondria to help the respiratory chain make energy. It's a form of niacin, and we do have the ability now, and in fact, there's a more stable form that's easily given subcutaneously,
Mhm.
and you store in your fridge. You don't have to keep it in your freezer, which was the big problem beforehand. And uh, you want to get it from a great source. You want it to come from, I like to get them from pharmacies because I know that they have to have third-party assays,
Yeah.
but that's helped us some, and we have a few genes to tell us who really needs it and who doesn't, but it's not a win-all for everybody. You know what I mean? So,
Can personally tell you, I love it.
okay, well, there you
I
go.
got some in my fridge. But to
For
me,
you. Yeah.
to me, it's like, I mean, I remember, the first time doing an IV of it, it's like, okay, this is intense. This is like, maybe I'm
Yeah.
dripping a little too fast. But the feeling afterwards, again, and another staff and I were going through it after doing some training, like, hey, we'll go through this first, and she's like, She's had ADHD and had been prescribed Adderall. I had never taken it. She's like, it's like a calm, like Adderall. Like you're clear, you're focused, but like calm. That's what she felt like. I'm like, okay. And then same thing. And then I would go and play hockey following or
Sure.
exercise. I'm like, God, I'm like the annoying 20-year-old version of me again. Like
Exactly.
the energy, like I don't want to come off gasping for air after 45 seconds. I could stay out for 2 or 3 minutes and annoy everybody who wants me to come off. And that's kind of how I feel now, like just doing these subcutaneous shots.
Well, I like to think about it as the 3-year-old. I have three granddaughters, 4, 2, and 10 months of age. But when they wake up in the morning and their brain's full of energy, they're nice and calm and relaxed and sweet
Hmm.
and cuddly. You get a 3-year-old to the end of the day when they're tired and the nervous system goes off, and it is not pretty.
Hmm.
So most people confuse that for that hyperness for energy, but it's actually a low energy state. And so when you have that distractibility and that unfocused, irritable behavior, that's a low energy state in the brain. So those are the things we need to do is to address that, and we certainly can address it by making sure we're getting better glucose delivery. We have a bunch of autophagy genes that we can measure in
Hmm.
our genetic panel to tell us whether you're at risk for developing insulin resistance, because by the time an A1C goes too high, it's you're 15 years too late.
Yeah.
Do you see what I'm saying? And so we like to really start addressing that because the brain is such a high energy organ very early on. And we typically use for that dikairoinositol, which is a
Hmm.
special form of vitamin B8, which helps
Hmm.
insulin work more efficiently. And other than that, we tend to use the peptides and other things to help us with that.
Yeah, it's that's where I think too. A lot of people don't realize like the dementia, like the Alzheimer's, it's 20, 30 years before you're labeled or diagnosed. The cardiovascular disease just didn't happen the night before. It was 30 years in the making. And having one, people just need to have better testing and better assessment aspects of what they're trying to look at and get into, and try to just dive into like how do you plan for the future versus react to the past, and I think that's where most people are still in the reaction mode. And part of our purpose of our podcast is just giving people information where they kind of start to like, oh, I need to pivot, I need to shift, I need to change. Maybe I've been
Right.
looking at my health the wrong way, and maybe they feel healthy and there's like, but maybe there's things under the surface they need to change, or maybe they don't feel healthy, but they've had bad information and they're not really feeling better from what they've implemented. So I love your insight on all of this because I think, again, it's in line with where my brain goes. I love genetics. I love mitochondrial health, and I love kind of marrying all the stories together, whether it's inflammatory neurotransmitters, because they all talk. So,
Exactly right. And it's really ironic, I think. Like we clearly know that exercise improves longevity and health in general, and it makes no common sense when you think about it practically. The harder I stress the cell, the healthier my cell is. But from a genetic and from a biochemical standpoint, it's all about what is the cell prepared to do. And so if you don't ever stress the cell and tell it what to do, it becomes lazy and it will shut down a lot of functions that are not proper. So, you've got to make sure that we're always telling the cell, we're giving it some stressors, we're making it epigenetically change the way it functions, and it gets into a healthier state. And it was kind of hard for people to understand that because you would think from an energy perspective, the more you sat on the couch, the longer you would live, but it's not the way it works.
yeah, there's no conditioning, right?
Yep,
I
that's
mean,
right.
and then, again, you go back to vestibular and you go back to actually what the brain wants. It needs fuel, it needs your oxygen, it needs glucose to be efficient, and then it needs stimulation. So it's this aspect of, if you're not stimulating it and challenging it, then there's no adaptation to stay strong and resilient. And it's this aspect of, yeah, I always just picture, we sit in like perfectly controlled temperatures, especially in Texas, like,
Yeah,
AC is just booming right now in the summer months, spring to summer months. But you're like, how many people are like, oh, they're temperature intolerance. Like, but again, like they're not doing things to really challenge those systems within the body and the brain to be really good at finite control.
And so, that's the whole thing. And I think as Western MDs, we don't take advantage of it like, the chiropractic community does and enhancing that. And you'll be shocked at how many people see me that we have to talk about diet, we have to talk about exercise, we have to talk about all those things because their family doctor never talked about them or something like that. And so, um, I would just encourage people to make sure they get a broad education on the whole system.
Hmm.
Genetics, I think, frankly, every newborn baby should probably get genetics. All it is a mouth swab of your, of
Yeah,
your mucosa. And,
it's gentle. It's not super. It's less invasive than what everybody was doing 5 years ago with the COVID swab. That's what I try to tell people.
what it does is no matter how you want to choose, whether you want to choose to vaccinate or not vaccinate or anything, we can prepare the body most appropriate for whatever the parent desires. But you also, things don't change. We will know how to help that child progress properly and develop in the proper methodology.
What's kind of you remember like I remember first like the commercials, with different medications. The first time like it really slapped me in the face. I was sitting there in the kitchen, the TV was on loud, and not necessarily like the first time, but it's just the ridiculousness of some of these like medical commercials. It's like if you have a G6PD deficiency, you should not take this medication. My wife's sitting there watching like TV and I'm cooking. I just started laughing like, who knows if they have a G6PD deficiency? Right. And
I,
so I always kind of use that reference of like, hey, this is the benefit of like, yeah, some of this information, like even in the future, if there's ever something that your doctor or your somebody on your team is like, hey, you need to do this, we could usually go back and look at, hey, does this make sense on, how you're going to break it down, metabolize it? Like, it's just good information that we can relay onto them, and maybe it changes their decision, and you don't have a bad response.
right. And well, you and I both know that general blood work that you get from the mainstream doctor is pretty much worthless for the most part. Okay. Maybe in thyroid occasionally, but the long and the short of it is you just, that's why I encourage people to go to functional doctors because they'll pay more attention to things that are a little bit more advanced, a little bit more creative, a little bit more health oriented than disease oriented.
Well, I think, yeah, I mean, I don't mind. Like a lot of times, even like your traditional 2.5 page, like your CBC, CMP, your TSH, and that's probably usually about it for your lipid panel. But what they do with it, like, oh, your triglycerides are going high, but don't worry about it. Like, those are the early signs, like for somebody like, hey, you're starting to have metabolic dysfunction. That's probably not new. Like, what else can we start to look at? Like, can we run markers to get a home IR score and start kind of being more in depth? Um, but yeah, I love it because patients are like, oh, I have blood work. Everything was normal. I'm like, oh, cool. Send it on over. And then you start looking at it like, oh, cool, your neutrophils are always high. Like, what's going on? Oh, that chronic sinus drip or that chronic, like, what's going on up there? And again, back to your background when you talked about
Sure.
ENT and doing sinus surgeries. I'd love to get your insight on that piece. Because again, I see a lot of patients that come into our clinic like, oh, this snaz just keeps on getting re-irritated, and I've had
Right.
3 surgeries for polyps and you name it, and it's just like, but it's still symptomatic and a problem. And I just feel like these patients, they're probably struggling with headaches, brain fog, fatigue. You know,
Because you didn't get to the source of the problem with the surgery. So obviously the source, so if you're talking about chronic sinusitis, first of all, I can tell you all kinds of things about it. Number one, you have an off balance immune system. We call it an immune mechanism dysfunction, which means you're not able to kill things very effectively. So you're inflaming them aggressively.
hmm.
We also know biofilms play a very big role in all the bacteria and fungal elements that lead to chronic sinusitis. And for people who are not aware of that, it's like a jelly-like substance that covers the infectious agent so that nothing can get to it and affect it. So you do have to use something to actually break the biofilm to be able to even impact it. It's not 6 weeks of antibiotics won't touch it because there's no antibiotic that can be carried into there. Third thing is typically their glutathione is deficient, especially their GSTP1.
Mm-hmm.
which is the one that handles mucosa and skin surfaces, which means glutathione not only detoxifies, but it's also an anti-inflammatory. And that creates an environment where they really can't control the inflammation of the sinus. And anytime you irritate a mucosa, it's going to produce a lot of extra mucus.
Mm-hmm.
And so you really, when you're dealing with that, the surgery is not the important part. It's really getting to the source of the problem and what is this telling us about the patient,
Mm-hmm.
especially from their immune system standpoint. So allergy testing won't even help you with that and getting allergy shots or sublingual drops or whatever you're doing because the problem is really a chronic infection that's covered with a biofilm layer that you have pretty much an inability to uh, resolve. Now, with that being said, I can tell you there are some simple things that can change for chronic sinusitis if you talk about it. If we change the pH and we
Mm-hmm.
even use a neti pot with some baking soda or other things to make it a high pH, that not only destroys biofilms, but typically creates an environment where bad bacteria and fungus cannot grow. So I'm a
Mm-hmm.
big believer in alkalinizing the body. I do like the neti pot idea
Mm-hmm.
because it's hard to get whatever medicine you want into a sinus. And so that seems to be the most effective way to do it. But, and you can also use some type of, we have some custom nasal sprays where we use EDTA, which grabs
Mm-hmm.
calcium and separates biofilms. But you need to see somebody who really understands the problem because it's not just aeration of your sinuses and opening the sinuses so you get more air in them. That's just not the proper treatment.
With your background and doing these, at some point you're doing these surgeries, was there like a light bulb moment where like, hey, like this, there's a better way to handle this, approach this?
The moment was really when I started paying attention to the immune system very aggressively. And we know there are certain mutations that are affiliated more with chronic sinusitis. The interleukin 6 and the
Hmm.
interleukin 5, both are common mutations, especially in Anglo-Hispanic people. And those are very highly correlated with a risk of chronic sinusitis.
Interesting. Well, anyways, I like that insight because it's just something where I feel like we see a ton of it, and it's just some of these people have had these issues for 30, 40 years, and in 2 months, it's like behind them just by
Yep.
understanding what's up there. The biofilm aspect is critical. Their prior solutions were maybe surgery or, throwing an antibiotic into the gut and hoping it gets there is to me is like ass backwards.
Yep.
But yeah, you're sitting there like, man, you never stood a chance, but like, just think your way through it maybe. And it's not that complicated.
Oh, and always, most people forget about the fact that even IV vitamin C's and we ozone therapies, we use low dose IV hydrogen peroxide, but
Mhm.
changing the pH of the body and making it an alkalinity of somewhere around at least 7.6 or above, you're going to do wonderful things for infectious processes in your body, no matter what, because it's just not an environment where things that love to take advantage of us can survive.
Do
So.
you have like, kind of your go-to things that you mentioned a couple of them, but for helping people shift the pH, you mentioned the like
Yeah,
the
so there's a supplement I didn't create. I've built lots of supplements for lots of well-known companies. In fact, my supplement company was Neurobiologics. I'm still a
yeah.
very minor owner of that, um, but I also am the design guy. But there is one called Acid to Alkaline that you can buy on the internet. It's all a bunch of seeds and everything. I cannot make it better. So I've looked at it. I'm just cannot improve it. It's been around for 20 years and it's about a $20 bottle. And if you take 3 of those capsules a day, I'm telling you, you will change your pH. So I keep pH paper in my office, and we have contests all the time with my patients. You know what I mean? And
Yeah.
I said, don't worry, because I'm going to win because I cheat. So anyway, but keeping the body alkaline is just very good physiologically for you. And
Hmm.
just about everything that's bad for us tries to create an acidic environment for us. So.
Well, that's like your waste off your cell meta, like all that stuff's acidic, right? And trying to have this like aspect to it. In terms of, you mentioned you had a recent knee replacement.
Yeah,
How far into your recovery are you?
2 months.
All right. How so in the
I can
world
do
of
it.
pet?
I'm back to working out. I'm squatting. But like I said, I cheated a lot. So I
Yeah,
used
so
exercise. I used exosomes. I use lots of peptides. I control my inflammation very well. For with more natural processes. I did use a little bit of low dose naltrexone, um, and um, and I had 2 rounds of exosomes that I did IV.
Hmm.
So pretty shocking. I got about 160 degrees of movement in it right now, so it's going
That is
really
great
well.
for
Yeah.
2 months out. That is pretty incredible. A lot of people be happy at 90 at that point. What so again, I love peptides. You willing to share kind of what peptides you use to kind of help with the your body's recovery?
Yeah. So typically I like to use kind of a grouping of one. I use gonadorelin a lot for men who
Hmm.
need testosterone enhancement because
Yeah.
I don't believe in pellet therapy too much myself. I like to have a fluctuating amount of testosterone so your receptors clear. That's
Yeah.
my personal bias. I'm not going to criticize other people who like them. I use dihexa a lot.
Hmm.
Dihexa is a peptide that increases brain-derived neurotrophic factor and nerve growth factor. I use TB500 and BP157 together.
Yeah.
Uh, I'm, I'm, I'm more of a fan of TB500 personally for connective tissue
Hmm.
recovery than BPC, unless they have gut issues, and BPC 157 helps that tremendously. We use a lot of thymosin alpha 1 because
Hmm.
thymosin alpha 1 is a natural bioidentical peptide that comes from the thymus and strengthens T cells. And pretty much in my office, you don't walk in and see me with a long-standing immunologic neurologic issue without having insufficiency in thymosin. So those are the ones we mostly use.
Hmm.
And we use a lot of sublingual applications, which is not as effective as injection, but we adjust the dose higher to try to make up for the absorption. And those are the main ones we pretty much see. I'm pretty familiar with most of them, but those are the ones that are kind of the mainstay of my practice. So
Yeah. I just do you have any colleagues that are watching your recovery and just like kind of overwhelmed or kind of blown away, stumped by how fast you're recovering?
absolutely. In fact, it's really interesting because my orthopedist, orthopedists don't clear their own patients for surgery. They send them to the
Yeah.
family doctor. But my orthopedist was very, very interested, and it turns out he's having to have a surgery. And so, guess who's one of my new patients? So,
That's 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 perfect. I
so in general, yeah, people are pretty stumped, but I wasn't surprised, obviously. So,
I went through last March. I blew my disc just being dumb. Like I like to again. I've always worked with my hands. I used to frame houses when I was doing university. And so I'm like, oh, I was prepping for concrete work at the house. I'm like, like I can prep it and then I'll just hire people to finish it for me. But I can do the forms and all that. So I was digging, shoveling dirt, and soil here in the Dallas area is very clay based. I'm not sure about Austin. So when every 3 shovels, it doesn't fall off the shovel, it just sticks. And like, you got 20 pounds of clay that just tugs on your back. Well, I did that for 8 hours. I wasn't happy. I'm like, if I got to
8 hours. Oh my
yeah, it was
gosh.
like Friday, and then I started Saturday morning, and the irony is like, okay, the hell with this. Like, I'm gonna hurt myself. I need to just, you know what? I'm hiring somebody that can come in with the backhoe and just do this. And then my back started hurting the next on Sunday morning. I'm like, oh, this is bad. And again, I'm like, oh, I'll just like do some rehab, work it out. I'm like, I felt better. Played hockey a couple times, worked out. Then I cut the grass like a week later for 2 hours. I'm like, oh, this is bad. MRI that Thursday. I had a 2.4 centimeter disc herniation, which is pretty sizable. Um,
Absolutely. Huge.
but it's crazy because like if I, position wise, like, hey, I could get the pain to go away. So in my head, I'm like, you know what? I don't have pain. I talked with a buddy who's actually down in Austin, does a lot of like disc rehab. He's like, hey, from my understanding, like people who do this like a steroid, because again, I had my neurosurgeon friend who's like, hey, take some steroids. I'll call them in. I'm like, cool, I'll go get them. But I'm like, I don't really feel like I need them. Like, what's the benefit? Like, I want my immune system to be like freaking Popeye and like Superman right now. Like, why would I do anything that tries to suppress? And so I kind of went through, I'm like, let's go through and, I took a mitochondrial kind of philosophy. Like I need energy, I need fuel, I need to be like amped up and have as much fuel as available. And I need to help my immune system. And so in 6 weeks, I redid my MRI. And so let's go like a week after my MRI, I went and did like the neuro exam and like my foot drop. I had foot drop. That was pretty much gone within a week.
But, oh,
And then I redid my MRI. But again, like I'm telling you, peptides and just like NAD and things like that were huge. But I had patients looking at me cross-eyed, like, you don't need back surgery. I'm like, guess not. Like my redid my MRI and 6 weeks later, there's no stenosis. Like the disc was fully resorbed. And I'm like, they thought I was crazy for playing hockey 6 weeks later.
right. Well, first of all, I did learn that I can't sit around either, and I know you're not one of those people too. So
No, it's tough.
yeah, but what you just proved is what we classically think is not correct.
Hmm.
And really, with the absence of neurologic findings, back surgery is never appropriate for pain
Yeah.
because it's not really the reliever of pain. It's not really the indication for it. It really is the neurological inefficiency that's a chronic nature. And the body has much better ability to recover than most people do think. So you should never decide on things like back surgery very rapidly, is my recommendation.
Yeah, I thought it was interesting because I try to, even a couple other buddies who are in the orthopedic world, I'm like, hey, and there's like, yeah, well, there's no research. I'm like even like what about just playing around with it on patients or something, just seeing if throw peptides in and just try to get even small case studies. And it's just
Orthopedists are not peptide guys. They're carpenters,
yeah.
and they know they are. So, the whole idea is, um, you're not going to get prepared by your orthopedist to have your orthopedic surgery. So you need to see somebody who's versed in it.
Yeah.
And the nice thing about peptides is that they are truly very close to bioidentical,
Hmm.
or they come from a piece of a hormone that you've had. And so the side effect profile is just about none. Okay. And the nice thing about like gonadotropin, which tells the testicles to make more testosterone, the one thing it won't tell the testicle to do is make more testosterone than the testicles capable of making.
Yeah.
So that's what's nice about it. But if I hand you a bottle of testosterone and say to a young man, here, take zero point 0.7 cc's, very good chance they might be taking quite a bit more.
Well, and then too, like the feedback loop, like you're not
Yep.
having the impact of the negative feedback where that testosterone is, and you're essentially firing your own factory workers that make testosterone. So that's the
Yep.
novelty of peptides are, to me, I love them. We love them in our clinic. Like our providers, are well versed in them. And again, the patients that when you use it properly, there's a lot of upside. But
Well, and that's the thing, and there's not a lot of downsides. So that's why I'm totally in favor of them. And then mentioning the steroids you did, so the one thing that you don't want to do is ever peak the steroids with a high plasma concentration. So
mhm,
these Medrol dose packs and these quote unquote cortisone shots for the most part are just a disaster because once you suppress the adrenal, it does take about 6 weeks for it to wake back up.
it's
So
crazy.
you just knocked out your cortisol for about 6 weeks. So if we use a steroid, we only use one, and that's Depomedrol,
Hmm.
because it's a micro bead that is slowly released, kind of like a patch. I'm not a big fan of oral medications just because the surge effect and is not really physiologic. Most organs release things in nice continuous manners.
Hmm.
And so that's just something that I think we need to think about the delivery methods a lot more and the potential outcomes. So
100%. I agree. Well, I know we've been on over an hour. I want to be respectful of
okay,
your time, but
sure.
you have your own podcast, right? Still Coffee with Dr. Stewart?
Correct. So it really focuses on the things we typically see. It's my daughter is my host, and so
Awesome.
yeah, she's studying to be a PA. So she's in her last year of college, and then she has PA school. And she's very functional. Her college degree is in exercise physiology, and so uh, she's I enjoy her a lot. Let's just put it that way. So
She's down in Austin with you then?
she's not. She's actually in Belton at Mary Hardin Baylor.
Okay.
Yeah,
Well, I mean, honestly, the amount of education that she's getting by these conversations and just to me, it's like a different set of lenses. Like that, I started getting into functional medicine and functional neurology while I was still going through like chiropractic school. So, you're going through physiology and biochemistry and you start looking with a completely different set of lenses, and that to me, I'm so glad I'm like, again, started that while I was still going through the grind of school, because kind of like, oh, this makes sense, like cardiovascular function. And then you start to marry things together. It allowed the dots to get connected far faster. So I think that's a huge benefit for her too, kind of having you as a mentor to connect the webs.
Appreciate that. I'm sending her a lot of other places too to make sure she gets a broad scope. So
You got to. Well, any upcoming, like, you still do any teaching, anything that
yeah, we do, but I do mostly podcast education and other things like that. We are working on a couple of new genetic companies. One that's really is looking at using a little AI and, well, I don't know if it's necessarily truly AI, but database modulation so we can learn a little bit more how these genes interact with each other instead of just isolating one.
mhm,
And we're hoping to have some pretty new concepts and nutritional combinations that can recover and make DNA younger.
mhm.
So we're looking at epigenetics and making DNA younger, and that's in a company called Extending Me. And so
Nice.
it's really a longevity company, and that's kind of where my interest is focusing right now, not only in just acute recovery, but longevity. So always keep working, always keep learning. You're never going to learn everything, so we're doing our best.
That's some of the best knowledge right there. You'll never know everything, but all you could do is keep on trying to get as much information in, and modifying as you go. Well, I really appreciate your time today. You're on Instagram. How can they find you on Instagram? What's your handle there?
With Dr. Stewart's the easiest way. It links
Dr.
to everything else. Yeah.
Awesome. Okay. Well, I'll make sure too in the show notes, we tag that, and make sure we get that in so our listeners can easily find it. So I really
I'll be
appreciate.
surprised if I call you to be on my show. Okay.
Hey, I'd love to. I mean, I just, to me, like, I love going deep on any conversation. And again, we could have sat here and probably went down a lot of different rabbit holes. And I really appreciate your time today.
Sounds great, man. My pleasure. Okay. I
Hey,
will
Doc.
talk to you later. Okay. God
Yeah,
bless you.
I know he said an hour. So I just want to be, I know, like, we're over that. I want to be respectful of that. But if you need anything, let me know. I'd love to, yeah, I mean, I love the
We need to
AI
get
stuff.
together. Yeah, I need to
Yeah.
get together and let you know and kind of show you what we're doing and how we're doing it. And I think it'll kind of mold uh, into your whole, focus in all your patients. You can tell I'm very chiropractic in my thinking as a general rule. So
Yeah.
most of my close friends are not, they're chiropractors. They're
Yeah.
not
It's funny because
MDs.
I'm like, I went into chiropractic because of lacrosse injuries, because I got so fresh. I thought I wanted to be an orthopedic surgeon.
Yeah.
And then I'm sitting here, I'm like, man, I wish also in chiropractic school I went through and did my MP. So it was way easier back in 2008 to get your nurse practitioner with a biology degree in chiropractic school. But I'm like, yeah, we have a nurse practitioner, but that's what it's like, we always train them, but it's tough to train a nurse practitioner to think the way you do and be as aggressive in the pursuit of, like, what we
They won't
do.
be. They won't be.
Yeah. But that's
So
for the AI
are you
piece.
doing PRP exosomes, joint injections and stuff?
We do PRP. The problem with our nurse practitioner, she had some health issues and she is hardly on site. So we'll do it. I don't like referring out because a lot of times you refer out to these groups and they don't care about, growth factors, inflammatory aspects, and they just kind of sit there and, for us, like, pretty much everybody gets significant benefit, and you refer them out and it's like, like negligible or nothing. And that's where I'm like, so we'll do them, but it's more so we don't go advertising. It's just more so we keep them in house.
Okay.
Um,
Well, I'm just looking for somebody to send them.
yeah, yeah. But like for us, before we go through, like, I want to make sure if you're gonna spend the money and invest in that stuff, kind of the growth factor and just like the equation around that signal to those exosomes and
Yeah,
the
so
stuff.
it's like for me, we use IV exosomes, and I mean, we're using the most potent ones you can find, period. But I won't give them to you the first day you walk in because I got to get your body prepared for it.
Yeah.
So, but uh, yeah, we need to get together sometime. So if you head down here, just let me know. If I head up there, I'll let you
Yeah.
know. And I think you
What's
should meet
the
some of
best?
my, yeah. So my phone number is 512
Yeah, let me sorry. I mean it's 512. Okay.
970 1903.
Okay. I'm just doing a call and I'll hang up here, but I'll put your
Sounds
info in.
good. All
Yeah,
right.
no, that's yeah, I gotta head down. I have a good buddy. He's a really good like sports chiro down there, and I've just
Who is that?
Stephen Rhinley. Do you know Sam Sneed? He used to work down there with him, and then Sam Sneed went in. There was like a big gym that they kind of went in with. I can't remember. It was massive. And
Hill Country Outdoor.
I don't
Yeah, I
think that
know
was
that.
it, but it was like a lot of like tech billionaires built this gym up with like NFL players and
Yeah, that's Hill
Sam.
Country Outdoor. Yeah.
Maybe that is, I mean, unless it so but it just that kind of didn't, Sam kind of got kicked out of that. And then so Steve, him and yeah, he loves Sam, but that I'm not sure. I think Sam's just working a lot with kind of professional athletes on the side now, from my
Yeah,
understanding.
so what you don't know about me, I'm a TBI guy. So I basically was the concussion doctor at the University of Texas for about 16 years. And I've done
Okay.
a lot of pro work on return to play criteria for athletes. And now
Hmm.
I do some personal injury on the physician, on the plaintiff side. So, because we always want to make sure that we can document the severity of the injury. And so, and I'm an ex-NFL Players Association doctor too. So I'd love to
It's a
to
whole
meet
other.
them and all that. And I know a lot of guys that are in the sports chiropractic world too. So I'm sure he'd love to hook up with those guys too.
Well, and so a lot, it's good. I think it'd just be good to have you in the loop because Sam and Steve send me all the functional med patients or even
Yeah,
functional neuro to our
yeah,
clinic. Because like, my business partner and I, he does most of the neuro intakes now and exams. Because wearing both the neurology hat and the functional med hat, like you have patients coming in about their vestibular findings, their VNG findings, and I'm like, hey, I'm prepped for your blood work to go over and deep dive into blood work or genetics or kind of whatever testing we did. And it was just a mental gauntlet for the 2 hour visit. I'm like, this needs to be so
you
he
know
you know
that
he
you know that all my stuff started when I'm a vestibular expert. So I've been working in vestibular medicine for 30 years. So
we just got a really pretty sweet new VNG system. I have to
hey,
show that. I can It's pretty cool. We could do like a whole bunch of new little because before it was like micro medical, but this one now you can do like depth of field perception.
and I don't
Uh,
like the guy that built Micromedical at all. I'm not fond of him, Rick. Yeah, so I
yeah,
know
we
those
we
guys like the back of my hand. I was involved in all the development of auto rotation testing and all that kind of stuff. So,
yeah.
so
I'm
we
trying to
still
think
use
the
platform here
yeah.
quite a bit, but we uh, Longhorn Imaging, which is a center here, does most of uh, the the medical legal work, and I read their VNGs. I read about 20
Mhm.
a week, and we do it with platform VNG and also with the Oxford neurocognitive testing. Uh,
Nice. I'm trying to find the name of this system. Oh, the Neuroline is what it's called.
Neuroline,
DX200 Neuroline.
you
I'm
like
trying
it,
to
huh?
I like it. I mean, they were purely research based, and so when the first interaction with them was a little rough in the sense of like they weren't used to having to deal with like doctor customers, like, hey, look, like, how do we do this test? Like, we want to have like this
Right,
test, like their perceived vertical alignment, stuff like that.
right,
And
sure,
so they were, but it's as you get to work with them, and you just have to be like, hey, you guys suck here. Like, we need get on a call
right.
with somebody that can help us, and they've been good. It's just, but the amount of information that we can get from this testing from micromedical is that was like for the first 3 months we were like, holy crap, there's so much more information we're getting now. And
Right.
so just getting good at reading it and integrating it, and then, okay, well, now we can do more. Now we can find little intricacies about like their perceived vertical that's messing with their vestibular responses and start to
So,
find.
yeah, you and I need to talk because VOR, vestibulospinal, all that kind of stuff is totally something
Yeah.
I've been working on for probably 20 plus years. So,
Yeah, so we do a ton of that. So next, if I mean the nice part with this system, it travels incredibly easily. So I can always bring it down and play. We can play around with it, and then
well, I'll come
we
up.
got
I grew up in Lake Highlands in Dallas.
okay.
So,
Yeah, so we're just that's just to the east of us. We're in Walnut Hill in 75. So
oh, are you good? So you're right by Presbyterian
it's
Hospital?
on the we're right beside it. We're the high rise right behind it. There's a dart line, and then we're on the other side. So we're
Yep.
basically our parking garage stares at it. So yeah, we're not
Yep.
far. But either way, no, we need to connect. I'll shoot you a text, and then
That's great.
I'll look to publish this episode next Tuesday or Wednesday. I'll do some shorts and clips to promo it. And
Problem. Just let me know if I can help you ever again. Okay.
yeah, no,
My
absolutely.
pleasure.
But I want to stay in touch. Have a good
All
one.
right. Sounds good. Talk to you later. Bye.
See you, Doc.